In the past few weeks, there's been a ton of debate on whether India is undercounting COVID-19 deaths and by how much. Today, I will talk about what I found during my reporting. To cut the long story short, yes, India is definitely undercounting COVID-19 deaths, and the extent of it is very high in some states. For instance, Telangana may not be reporting as many as 50% of its total COVID-19 deaths in its official numbers. Basically, there are two kinds of undercounting happening in India today. To understand this, we need to grasp the concepts of suspected and confirmed COVID-19 deaths and why it is important to report both categories. First, what is a confirmed death? When a person develops COVID-19 symptoms and tests positive on the RT-PCR test for the SARS-CoV-2 virus, their death is considered a confirmed COVID-19 death. That is, it was confirmed via an RT-PCR test. On the other hand, if the person has all the symptoms but tests negative or is not tested at all, the death is considered a suspected death. It's important to record suspected deaths also, because even if a person has a negative RT-PCR test despite having symptoms, it doesn't mean they don't have COVID-19. This is because the RT-PCR test gives false negatives. It's not a perfect test, and its reliability depends on a number of factors, such as where the sample was taken from. For instance, one study found that when the sample for RT-PCR is a nasopharyngeal swab, which is part of your upper respiratory tract, the test may return false negatives more often than if the sample comes from the lower respiratory tract. This could be because the viral load is higher in the lower respiratory tract by the time a person becomes severely ill, which is when they're tested. Knowing this, knowing the high rates of false negatives in RT-PCR, when doctors see a patient with symptoms like breathlessness, hypoxia, fever, cough, pneumonia, and they know that the patient lives in a region with a high number of COVID-19 cases, like Chennai or Ahmedabad, the doctor will start treating that patient as a COVID-19 patient. That's because the probability that they have this viral illness and not another viral illness that's similar, like influenza, at this time in this region is high, even if there's no confirmation. This is why if such a person dies, the death must be reported as a suspected death. Recognizing this fact, many countries count suspected death. For instance, the USA asked its states to include what they call probable deaths, which is another word for suspected death, in its death count since April this year. Currently, 24 US jurisdictions are reporting them, as you can see on the CDC's website. And out of these 24 jurisdictions, if you look at New York City alone, probable deaths are almost 20% of the total deaths reported by the city. But no state in India is doing this. In fact, the Joint Director of India's National Center for Disease Control, Himanshu Chauhan, told me on phone that it wasn't India's policy to count suspected deaths. This is a problem because India has amongst the lowest rates of testing in the world. Many people are dying with symptoms, but without getting tested. Some places like Gujarat still have very restrictive RT-PCR testing policies. For instance, a doctor in Surat told me that if a patient has to get an RT-PCR test, they must get admitted to a hospital. He said this had led to many people avoiding getting the test. If such an untested person dies at home, it would be a suspected death, and Gujarat wouldn't count it. So that's the first kind of undercounting, where suspected deaths are neglected. And all states in India seem to be doing this. There doesn't seem to be any exception. But let's talk about the second kind of COVID-19 undercounting. Here, what is happening is that some states are attributing COVID-19 deaths to comorbidities. Now, let me explain what a comorbidity is. Many patients who die from COVID-19 tend to suffer from chronic illnesses like diabetes, cancer, tuberculosis, heart disease, AIDS. These illnesses tend to worsen the course of COVID-19 in such patients. However, when such patients die, it doesn't mean they died from diabetes or cancer. Such an occurrence would be rare. Most of the time, if a person dies after contracting the SARS-CoV-2 virus, the person is dying from COVID-19. Still, as I report in my story, at least 3 Indian regions are currently attributing COVID-19 deaths to comorbidities, which means that they're claiming that deaths among people who tested positive for the virus were actually due to some other reason and not COVID-19. This practice is in contravention of guidelines which the Indian Council of Medical Research issued in May this year. Anyway, these regions which are indulging in this practice are Gujarat's Vadodara and Surat and the entire state of Telangana. The medical officer of health of Vadodara Municipal Corporation told me that 75 to 80% of the COVID-19 deaths in the city were being attributed to comorbidities like diabetes. That's a really high number. Because of this misclassification, the number of COVID-19 deaths in Vadodara are hardly growing, even though the number of COVID-19 patients in the city has been growing by leaps and bounds. Have a look at this graph, which shows all of the cases and deaths in Vadodara in July and until August 6th. As you can see, while the cases, which are the blue line, have grown from 2,338 to 5,256 on the 6th of August, a jump of 124%. The deaths, which are the red line, is almost flat. So basically, the deaths have grown just 15% from 89 deaths to 103. This is a pretty unusually low mortality rate, but it doesn't mean that Vadodara's inhabitants are somehow genetically protected from COVID-19. It only means that Vadodara is not counting most of its COVID-19 deaths. I also want to talk about Telangana, another example of misclassification. On 16th of May, Telangana's health minister said something very strange in a press conference. He said that the state would, from then on, follow ICMR guidelines and not count deaths due to comorbidities in its COVID-19 death toll. Now, the reason this is strange is because it turns ICMR's guidelines completely on their head. ICMR said, don't attribute COVID-19 deaths to comorbidities. Itala Rajendra, Telangana's health minister, said, not only will we attribute COVID-19 deaths to comorbidity, we will also not include those deaths in our death toll. Given these two types of undercounting, not counting any suspected deaths and removing deaths due to comorbidities from one's death toll, how many deaths is India missing overall? The answer is we really don't know. We only have some clues. For instance, after the US states started reporting probable deaths, the number of probable deaths reported by New York City was 20% of total deaths, as I said earlier in this video. So this could be the number many Indian states are missing. I do believe the number is higher than this because India has far lower rates of testing than the USA. There's also another way to count suspected deaths. Since COVID-19 deaths have to be handled specially to minimize infection risk, it means basically the bodies are wrapped in plastic, the family is not allowed to touch it during a burial or a cremation. This means that many crematoriums and burial grounds are maintaining a record of how many COVID-19 bodies they have handled. In some cities like Bhopal, these numbers, that is the number of COVID-19 bodies handled by deaths in crematoriums, have been compared with the official death toll of the city. And there is a difference. On June 24th, NewsClick reported that the difference between the number of COVID-19 bodies handled by Bhopal's crematoriums and burial grounds was almost double the number of official COVID-19 deaths in the city. So if this is any indication, the city may be missing 50% of its COVID-19 deaths. When it comes to deaths due to comorbidities, the two erring states that we know of are Gujarat and Telangana. In most other states like Maharashtra, when I spoke to the state officials, they told me that they are not indulging in any such classification exercise. So that's a good thing. But in Gujarat and Telangana, who are doing this, first they may be missing up to 50 to 75% of total deaths in the deaths due to comorbidity category. In addition, these states are also not counting suspected deaths like pretty much every other state in India. So if you put these two categories together, the amount of undercounting in these two states would be huge. That brings me to the final question. Can we solve this problem of undercounting somehow? The experts I spoke to for my story suggested several solutions. One way was for external experts to visit Gujarat and Telangana and to reanalyze the clinical records and medical certificates of cause of death so that the real death toll could be extracted. Also, they said that the Indian central government must ask all states to report its suspected deaths as well. All this is important because having an accurate idea of how many people are dying due to this disease is not just of academic interest. This data helps scientists understand how the disease is behaving in India and whether there are genetic and demographic factors which are impacting the severity of the disease. This data also helps policymakers take decisions about what kind of resources to allocate to fighting COVID-19. After all, if you don't know what the burden of COVID-19 is, how would you make these decisions? This is why it's time for India to work harder to get its COVID-19 debt toll right. Thanks for listening and have a nice day.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.